Okay, so it's officially 5 o'clock, and this is our June webinar for regenerative medicine and all things stem cells. I'm Dr. Richard Kim. Welcome to our webinar, and let's get this started here. Give me 1 second. I'm going to pull up this slideshow and just need one more file sharing. Okay, great. Here we go. So, again, I'm Dr. Richard Kim. Welcome to our webinar. A couple of instructions for those of you who are watching. Number one, turn your volumes up if the volume's down, in case you can't hear me. Number two, there is a Q&A button at the bottom of your video viewer. You can click on that and ask me questions. Feel free to ask a question at any point in time, but I am going to wait till the very end to answer them all. So let's get started. Really, we want to talk about stem cells, but we want to talk about specifically how stem cells solve pain. We've got a couple of Q&As to begin with, as I've collected them over the month here. Michelle T from 315 says, watching for my husband's back pain issues. So certainly this is a great place for you to learn about regenerative medicine as it pertains to back pain, but specifically what it is, how does it work? Thomas MS from 518 said, what is stem cell therapy? Is it for me? So that's another good one, right? So who does this help? Barbara, forgot a name there, from 514 said general information on how you diagnose treatment when all other methods have failed. Do you have services in Montreal? So number one, getting regenerative medicine right. How do we do that? How do we do that well? I'll talk about that a little bit later in some of our Q&A. The second thing is diagnosis. Diagnosis is incredibly important. So for us, we have an in-office MRI. I've had 10 years of experience with this. I've had thousands of patients. And for you specifically, for those in Montreal, we have a dedicated office in Plattsburgh. So yeah, just a 45 minutes drive just across the border. So let's talk about some of the common goals you as patients have, we as physicians have. Number one, we want to all avoid surgery as much as possible. In particular, spine surgery is one of those that sometimes we hear not so great things about. And so we have a lot of, incentive to avoid that. Number two, we want to stop medications. Sometimes for some of us who are taking medications on the regular, having to remember them, constantly take them, depend on them, can be a burden. Number three, quality of life. We want something that is going to improve our quality of life measurably. When it comes to these common goals, we want a few things ensured. Number one, we all want a plan. Number two, we want that plan to be safe. We want low risk. We want short recovery. We want to avoid the pitfalls that sometimes can happen with things that happen in medicine, procedures and surgeries and medications and otherwise. Let's give you a couple familiar examples. Number one, it's a retired psychologist who flies airplanes for a hobby. There's also a runner, competitive, but also does it for stress relief. But the back pain ended his running. So no more, that meant no more competition, no more fun, no more stress relief, really limited his flying time. The second is a chef who enjoys spending time with family, but the work was constant motion, moving heavy restaurant equipment. Really was starting to affect his work, difficult work days, and even contemplated changing his careers. Traditional medicine misses the target. When we think about traditional medicine for pain or traditional treatment for pain, we really look at surgery, which can tend to be permanent, it's invasive, there's always a long recovery. Number two, issues with medications such as steroids. They're a band-aid. We all think of them as band-aids. They help temporarily, and then you have to use them again. But not only that, but they weaken and they damage tissue. And we're seeing more and more studies and more evidence of that. That means repeating the steroids really means having a repeat weakening and a repetitive damage effect, which isn't great. Over-the-counter medications certainly lessen symptoms, but the effects wear off. You've got to repeat the dose, and certainly things like ibuprofen, NSAIDs, can damage your stomachs, damage your kidneys, and that is unwanted as well. 2 months after the stem cell therapy, our psychologist returned to running, ran the 4th of July race here in our local town. Was a 4 mile race, ran it at a 13-minute pace, wasn't his fastest, wasn't his favorite, but was happy that he could do it. It gave him enough confidence to train for a half marathon with his grandson, and come to find out that was really what he was aiming to do by having his back pain go away. The chef was back at work, working full time, providing for his family. So certainly a quality of life measured there for him. So how do we do this? Well, the important thing is you have to break the cycle. If you have pain, that leads to degeneration. And when you have degeneration, it leads to further pain, and then so on and so on. And then when you're stuck in this loop, in this cycle, there's it's a very difficult thing to sort of break out of it. Well, that's where we come in. We're really the third solution. With us, we have a relatively high success rate, especially in comparison to things like medications, things like surgeries, and unlike the medications, we are the services and the type of therapies we have provide years of relief. The fact that the cells come from you back into you means guaranteed acceptance. So no rejection, no issues, no contamination issues along those lines. But what exactly is regenerative medicine? It's definitely a new field of medicine. And the key here is that we're working to restore and not replace tissues. So we're really taking the damaged tissues that you have and turning them into a healthy and functional tissue. The different materials we typically provide are either platelets, PRP, or stem cells. And if you can see the three different circles there, PRP is great for the green and yellow circles, let's say small, medium problems. And the stem cells are really great for the medium to medium and large problems. This is a good video of what happens when you have an inflammation area like the red, and then you have green, which is good and attacking that area. The red is what we feel as pain, stiffness, sciatica, nerve pain, shooting symptoms, aching, grabbing type symptoms. This is a good way I like to explain PRP versus stem cells. And it's really the Pac-Man problem and solution. If you remember Pac-Man, those are all the little pellets of inflammation. One Pac-Man eating one pellet at a time is what PRP is like. However, when many Pac-Man eat many pellets at the same time, that's what stem cells are like. The goal here is to really beat the game, beat the problem, not just make it to the next level and then play this game all over again. Let's just stop playing it altogether. And when we talk about that, we're talking about something that can really give you that for 5 to 10 years at a time. Where do the cells come from? This is a good example. That spinning pelvis on the left there is a example of your pelvis. We extract cells from that region and then inject it into the disc there, and then obviously help restore the function of that disc. Typical timeline and schedule for us. Initially, we like a consultation. We have an MRI, so an MRI would happen somewhere between consultation and the second injection typically. The first PRP followed by stem cell and the second PRP, and then the third PRP. So what you're seeing there is a total of 3 injections, an MRI, and an MRI. Physical therapy, chiropractic care, exercise, these are the sort of things that are going to start from the third injection pretty much immediately on. And I tell this to people all the time. I can inject you for pain, but I can't inject you for strength. That you have to build. Well, what can we help? Stenosis, arthritis, degenerative disc disease, sciatica issues, certainly in the neck and back. In the lower body, problems with arthritis, the knee, the hip, the ankle, bursitis of the hip, meniscus damage, and I'll talk about a couple of these. Achilles tendon in the shoulder and the upper arm, rotator cuff issues, arthritis, tennis elbow issues, as well as carpal tunnel. A lot of people want to know, well, am I a candidate? And best way I like to explain this is that if it can be injected or if it can be operated on, meaning I can get a needle to that area, I can deliver stem cells to that area. It's important, however, that you have a diagnosis. An accurate diagnosis means an accurate location, which then translates into an accurate therapy. And I can't emphasize that diagnosis, location, and therapy sequence enough. Of course, our therapies always include an MRI. And that MRI is in our office. What if you've had surgery? The answer is yes, you can still be a candidate for this, but a consultation would be key. And the key to that is we're going to go over your diagnosis, go over your imaging, certainly your history and exam during that visit. The type of surgery is important, whether you have had an arthroscopy, whether you've had a fusion of the spine, a rotator cuff surgery of the shoulder. Some of the frequently asked questions: where will my stem cells come from? Always from you, back into you. So pretty straightforward. How long before I can become active? Again, you saw that timeline. Once you've hit that third injection, you're becoming active after that. When do you feel the benefits? I would say the majority of the people feel benefits by the third injection, meaning the beginnings of it. But some people can be as far as 8 to 12 weeks out. I would say if you've had surgery on that area, be prepared to be one of the slower ones to respond, as surgery can lead to scarring and adhesions and issues with inflammation. How long will the tissue stay repaired? Again, anywhere from 5 to 7 years in a lot of peripheral joints, meaning hips, knees, and 7 to 10 years when we're talking about issues in the spine. And lastly, how well does this work? So varies from person to person, varies from spine versus peripheral joints, and is very much individualized. So we definitely like to have that conversation at the time of consultation. Let's get into the Q&A. So Annette from 518 said, can it help with several damaged lumbar vertebrae? So the answer is yes. So let's talk a little bit about how a damaged vertebrae might appear. And we're talking, let's say, for example, degenerative disc disease. So I like degenerative disc disease and talking about it in the sense of jelly leaving the donut. If you've got a jelly if you've got a jelly donut and the jelly leaves the donut, that's the presence of a degenerating disc. When the jelly leaves the donut suddenly, we call that a herniation. So these are two really cousins, really just based by time. So for us, if we're able to help you fix that donut, you have a more functional donut. And when you have a more functional donut, you have a more functional spine, therefore allowing you things like tolerance of activity, physical therapy, exercise, and so on. Mila D from area code 305 says, I have a degenerative L4 and L5, 3 bulging discs, bone spurs causing left-sided sciatica pain. So this is a really good point that we get this question periodically. We can treat multiple discs at the same time. So even though you may have 2 or 3, 4 is our maximum that we can go in one, what we'll call 3 injection session. So for sciatica, stay tuned. We're going to talk a little bit more about that. But again, really what we're trying to do is restore the functional aspect of the disc, and then of course, then restoring your spine. Robert from 518 said, back pain and arthritis. Again, yes, degenerative disease, arthritis. These are really two of the same. We think about them interchanged and very much the similar process. By treating the degenerative disc disease and the arthritis, given that they're related, that's going to obviously help with the spine. For us, it's a very frequent problem we see in our office, something that we come across every day. Every other patient seems to be degenerative disc disease. So very frequent for us, so very common space for us. Mr. T from area code 315 said, just simply back degeneration. So Mr. T, you've heard me talk a little bit about jelly donuts. You heard me talk a little bit about the fact that we've got multiple discs. A very important thing that I want to emphasize is our process is non-surgical, number one. So that's going to be something I'm going to say repetitively throughout this process because it is important. And then, of course, for us, an MRI is included. So even though you say back degeneration, we like that MRI to help us decide where we're going to go, where these therapies are going to go, where these stem cells are going to be placed. Carol from 514 said, are there any other options to reduce my lower back pain since 2006? I also suffer a lot with sciatica, right side since 2006 and left sided since 2024. Nothing helps. Sorry. Cortisone injections, massotherapy, acupuncture help sometimes, but not often. Even my many medications don't help much anymore. I want to have a better quality of life and I really want to be able to go back to work. I stand all day at work. I also have fasciitis under my right foot, and I'm on medical leave since August of 24 for both my back, which is in the stage of unbearable. Also for my left knee, it's getting worse instead of getting better. Surgeon is seriously thinking of operating on my knee. Please, can you help my situation? So I'm sorry to hear that you're going through all of this, Carol. But I will say that the sort of things that you have going on with you for us, it's a very common situation and a very common scenario where somebody will have a degenerative disc, have issues with their knee, and even problems with their foot. So for us, regenerative medicine, stem cell, platelet-rich plasma are excellent options for this. Um, a great way for you to get therapy, never undergo the knife, never undergo surgery. You can recover from home, I'm assuming in Montreal or in Quebec. Um, for us, sciatica and back pain, very closely related, is something we treat often. Plantar fasciitis, knee, things that we've all had very successful therapies for before, so we feel very comfortable with. For us, the next important thing is consultation, but I would certainly be prepared to talk about which of these three is the worst one. And it sounds like the back is the leader here, so I would probably think that that's it. But again, I'll leave that up to you at the consultation, and we can go over all of that. Aaron C said, I've from 561 said, I've had multiple back surgeries on disc from L3 to S1 from 99 to '05. I have a right foot drop. L4 is dead and diagnosed with cauda equina and degenerative disc. I've been on morphine, other meds for pain control from my lower back down my legs into my feet and toes. I've had a spinal cord stimulator implanted in 20 and still in a lot of pain and taking morphine 24/7. Ugh. Cortisone epidurals at the bilateral L4 nerve roots significantly reduces the pain. I'm 62 years old. I've controlled ischemic from heart attack in November of 22, but otherwise in good health. Could stem cell therapy help me? Right. So this is a really great example, right? So have a patient who has some other health issues, things like heart disease. So all obviously things like surgery surgeons tend to shy away from patients like this. Patients tend to shy away from surgeries like this. Certainly, stem cell therapy sounds like it could be quite beneficial for you, especially for the issues of the degenerative disc and the low back pain. Consultation is key. Certainly, we need to meet you. Want to talk to you and see exactly what we can help with, what we might not be able to help with. I would definitely say in here the pain versus nerve issue is going to be key. For us, we can certainly help you with the pain. The nerve issue tends to be a little bit more of a question mark, so it tends to not be the primary goal and the primary objective for stem cell. Pain tends to be. For us, we'd lay out some clear goals. Number one, can we get you off of that morphine 24/7? Because that's not obviously not that good for you. Number two, can we improve your quality of life? And certainly from here, we can certainly make an impact. Chris Ness from 704 said, I've lived with chronic neck and shoulder pain due to several accidents, getting worse, causing other issues. Like to understand more about this therapy, how it works, whether it's the right option for me. So I like to talk about epicenter and collateral damage. So for instance, in this example, maybe the neck, maybe the shoulder is the primary driver of pain. And then you start developing other areas, right? So even though you start with the neck, the shoulder shows up, the mid back shows up, and then they become their own sort of centers of pain. So it's important to try to get to that one worst center, the one that started it all. Sometimes that's not possible, but if you can, I would say approach it from that standpoint. So you may have one and you may have two issues. Again, consultation, next step, trying to figure out that diagnosis. And again, you can hear me talking about how important getting that diagnosis right is in all of this. Gordon C from 438 said L4, L5, S1 injury 3 months ago, plus a herniated disc, would like a professional opinion and diagnosis. Again, multiple disc therapy, very possible. So even though you have clearly multiple discs that are injured in this with herniations, that's not an issue. Herniations and degenerative discs, close cousins in that jelly donut example, and certainly a consultation would be the next step. Jamie A. from 716 said, I've had extensive back surgery in November of 21, rods, screws, cages, fusion from L2 to S1. It has not relieved my pain. Even though I get nerve blocks about twice a year, I'm interested in seeing if Dr. Kim can help me. Please allow me to attend the webinar in June. Thank you, Jamie A. So hopefully you made it here to the webinar, Jamie. And I can tell you that it sounds like you've got failed back syndrome, and we have helped failed back syndrome a number of times, something we're very, very comfortable with. I would probably add another diagnosis onto a lot of this, something like adjacent segmental disease. And the idea behind that is the idea of bike chains. So if you haven't heard me talk about this before, it's the idea that, say, if you have three bike chains and the two in the middle are locked, the bike chain link immediately after and then one immediately before have to become more flexible in order to compensate for the one in the middle that isn't going to move. So we call that adjacent segmental disease. So with our therapies, a lot of times we are doing something like treating the disc both above and below the fusion, aka also known as oiling the links maybe before and after that bound bike chain link. Jake J from 514 said, spine neck injury causing me to have seizures and partial seizures repaired. So this sounds a little bit different. I would certainly want to understand the etiology or the source of the seizures. So for you, if you have EEG data, that's important. If you have MRI data, important. If you've got neurology notes and MRI results, certainly please bring that with you at the consultation. Robert L. from 732 says, effectiveness of stem cell treatment and options. So the effectiveness varies per person, per location. So I would say joints versus spine, that matters. So whether or not you've had surgery in the past in that area matters. Whether or not you've had prior injections in that area matters. So certainly if those are your specific questions, which are great questions, really is dependent on what you're asking for and how it relates to you. Vicky L from 518 said, I've had a full knee replacement and I have a stimulator into my spine, but I still live with continual pain all the time. Sorry to hear that, Vicky. So for those who have had knee replacement, unfortunately, there is not a ton that regenerative medicine can help with. And a lot of that has to do with the fact that once you do a knee replacement, then the bones, the cartilage, all the things that we typically would need to help improve your pain are gone. So that is one of the limitations. So while you're having both knee pain and spine pain, I'd want to know for you specifically, where's that location of pain? Have you had recent MRIs? Following up with us to do an exam is certainly important. The quality of life and what you're looking to achieve, certainly important. So if you're looking to walk a mile at the end of the day, sure, that's a goal that we can work on, and I think we can help you obtain. So want to start marathon training. That might be a little bit different, right? So these goals matter. Jeff from 201 said, can this help after 6 surgeries, 5 fusions, or is it too late? So one of our specialties, as I was mentioning before, is those who've had failed back syndrome, failed surgical pain, adjacent segmental disease. This is something we're very, very familiar with and we can help with. So even though you've had 5 fusions, we can still help. Certainly a consultation would be important. Imaging, if you have it, is important. If not, then that's okay. We have our own MRI and we can help you understand what is and is not possible. Michael from 438 said, I'd like to know more about what your stem cells can do for my knees. So this is a good time to talk about room and holes and debris. So the way I like to talk about knee, let's say degeneration, is the whole idea that if somebody walked into a room and started punching holes in the wall, debris would fall to the floor. Stem cells clear the debris. They don't necessarily fill in the holes, but they help clear the debris. And it works so well, in fact, that it can last for 5 to 7 years so that you can walk across the room freely, right, without having to step on the debris, step around the debris for 5 to 7 years. So that's a pretty apt description. Neil AK from 518 says, need help with severe OA of the left knee. Certainly arthritis is something we treat, we see a lot of. We don't want to understand your clinical history of whether or not you've had surgeries, whether or not you had injections. So surgeries, probably arthroscopies if in the past. Imaging, if you have them, is helpful. So that's a good time to talk about the importance of imaging. If you have imaging, great. If not, that's okay. Don't feel like everything has to be sort of queued up perfectly before coming to us, because again, we have our own MRI machine. And so for anybody we have any questions about, we can put through the MRI. And a lot of times even on the same day. Consultation to see whether you're a candidate. So there you go, Neil. Joanne F from 315 said, interested in stem cell therapy for knee pain. One of the things here is that, it gives me a good moment to talk about the fact that if you can restore the inflammation, you can restore function, you can restore stability. So building you a window or a portal of being pain-free, if you can do that, you can do things like working on strength, working on physical therapy, working on exercise. And success begets success. So we oftentimes hear, well, great, I'm out of pain, but I'm significantly weak. Sure, you've had knee arthritis for, 5 years or 10 years or however long it is. It's going to take time to bring that strength back and rebuild all of that. I'd say for us, and not just us, but out there in the medical research world, it was the first body part studied for stem cell therapies, one of the most studied. For us, it's important to let you know that it's in office. There's no scarring like you see with knee replacements involved. There's a consult and imaging that are going to be part of all of this for you, Joanne. But a pretty significant point there. Beth M from 607 said, interested in alternatives to knee replacement. So this is it, right? You came to the right place, Beth. What we do is non-invasive. And majority of times, you'll see physicians do something like steroids, and then when steroids don't work, then immediately have to go to doing something like a knee replacement. Well, we really fill in that gap between steroids, which I would say is either non-invasive or very minimally invasive, to something like a knee replacement, which is hugely invasive. So we really are the new solution. We sit between those two things, and we consider ourselves a minimally invasive solution. Maria DC from 514 said, what can be done for pain, regeneration, disc, and other? So regenerative medicine is your alternative instead of taking pain meds, instead of surgery. Again, we talked about that treatment gap before. Regenerative medicine is the perfect place for that to sit. What we like about it is that it's 100% natural. The cells come from out of you, then go back into you, and oftentimes all in the same visit. So there's not even a wait period from the time that the cells are extracted to inject. And again, for discs specifically, we're looking to improve the quality of the disc, which means that you can improve the function of your spine and then improve motion. Katharina DM from area code 607 said, I've got chronic pain in my low back from an accident 18 years ago and now arthritis. I've been living on pain meds that are not working well. I love to horseback ride, golf, garden, and this is interfering with my life. What are some options to relieve the pain? Right, so horseback riding, golfing, gardening, these are all things that we equate as quality of life, and this is what we want back. Certainly having had these injuries, these accidents 18 years ago, sort of represents what we call macro trauma. But some people don't even have those big accidents, and they may be at a labor-intensive job. They may be doing certain exercises that what we like to represent as micro trauma. So whether it's small accumulating trauma or these big instances of macro trauma, it can still lead you to the same point, to the same level of our arthritis. Our method again, non-surgical, and a great option for somebody who's looking to return to things like horseback riding, golfing, gardening, and certainly after our therapies, these are all very, very doable activities without ever visiting a hospital. Michael A. from 438 said, simply knee pain. Frequently treated issue for us, 5 to 7 years of success. Consultation, imaging would be important for you, Mike. Ralph from 904 said, is stem cell therapy guaranteed to stop pain due to a meniscus issue, such as a tear or wear on the meniscus? So we just treated a 15-year-old with a meniscus tear this morning. So this is absolutely an excellent option. So 15 to 95. We've done this for every age, especially those who have meniscus tears, or even if you've had surgery before for a meniscus and you develop pain later on. This is a good way to avoid steroids, avoid surgery. The meniscus for us is, as I mentioned before, a frequently treated area. Johnny from 514 in French wrote, do you treat lumbar and cervical stenosis and hernias? So Johnny, I wrote you a translation of our answer in French there. So yes, frequently treated and quite successfully. This is one that we like to treat because people do so well from these stem cell therapies to both lumbar and cervical stenosis. Next step for you would be a consultation to come in, talk to us. If you have imaging available, we would love to see that. And we offer French translation through an app at all visits. So no worries if language you feel like might be an issue. Wendy from 518 said, is this treatment effective for hip bursitis? What is the recovery time? So great. So hip bursitis, it is very, very effective. So for us, hip bursitis, when we look at hip bursitis, is often the problem of the tendons breaking down where they attach on the hip, then leading to a bursitis. So if you actually treat the tendon, you treat the bursitis. A lot of times when we do this is a one and done. We do one, works well, patient doesn't come back. And I would say for a large majority of the time. So certainly come see us, Wendy. Joanne L. from 518 says the process, cost, recovery time, does it work on arthritic hands? So hands respond very well. We treat a lot of the ones sort of at the base of the thumb there. We treat people who have carpal tunnel issues, even in the knuckles of the hands. The hands, like I said, respond well. The recovery time is relatively short. Cost depends on diagnosis and additional factors. Hard to say without having met you. It's like saying to the mechanic, I hear a noise in my car. What's that going to cost to fix? They won't know until they see you or until they see the car. So consultation for you there, Joanne. Elaine from 438 said about rheumatoid arthritis. Yes, very similar to the hand issue. So even if you have rheumatoid arthritis, we have used regenerative medicine many, many, many times for those with autoimmune diseases like RA. So very, very familiar, very comfortable with that. We'd want to know certainly, where's the arthritis affecting you? Is it simply in your knees or is it in your hands? Do you have multiple joints? So a lot of planning is involved, I want to say, with rheumatoid arthritis. So we'll get through all of that during our first conversation. Neil G from 514 says, how lower back issues can be addressed. So this is a great example here where stem cells and platelet-rich plasma really do two primary things. They release growth factors and they help control inflammation. So when you're doing that in the spine, you have to understand how the disc itself receives nutrition. So the disc itself receives nutrition not from blood vessels, not like we normally do from our hands or when we cut our face, it bleeds. The disc isn't like that. The disc receives nutrition through that cartilage end plate, and you can see that I've circled it in red. So through the bone, through the cartilage end plate, then into the disc. So for those who've had trauma, the person who had an accident 18 years ago, this is a great example where you would disrupt that close connection. And then once the disc starts to degenerate, it just progressively gets worse and worse. Stem cells help reconnect that, help recreate that connection through these growth factors and inflammation control. The key is you have to put the stem cells in the right place. And obviously, that's what we've become very good at. And we're talking about something that can last 7 to 10 years. Julie V from 585 says, how the stem cell therapy is effective for back pain. What is stem cell? How can it help me? So back pain, again, very common. Consultation is the big first step. Help us make that diagnosis for you. So back pain is a symptom. Degenerative disc is a diagnosis, for example. And then we can go over the details of the therapy. It is what we call autologous, comes from you, back into you, and it can last 7 to 10 years. Peter F. from 518 said, information on therapies for disc disease and sciatica. So when we talk about the spine, we like to talk about the functional unit of the spine. And what does that mean? It's the idea that the spine is made up of multiple parts, not just a single disc, but it's also made up of joints, ligaments, muscles, tendons. And in our process, and this is why we've spread out 3 injections over as many weeks as we do, is that you have to treat them all. So we want to make sure that we're going to address that entire functional unit. And that's honestly why I think that a lot of our patients do so well, is that nothing is getting ignored. So if you have 2 discs, 3 discs, you've got arthritis in addition, you have ligaments, muscles, and tendons that are problematic, we're going to go after them all. A lot of times surgeons typically look at an MRI, find one issue, treat that, and then wonder why the patient still has pain. And it's because we feel like the functional unit didn't get addressed. And that may correlate to why the spine surgery failure rates are what they are. Jeff S. from 315 said, how disc degeneration can be reversed and the symptoms lessened. So same picture here. It's not so much that the disc degeneration is going to be reversed, but we are going to restore the integrity. So think of a jelly donut that is flattening and jelly continuing to leak versus a somewhat flattened jelly donut, but now it's whole in the sense that no more jelly is leaking. So that's the important difference in what stem cells can do as examples go. And what we really are seeing is that it's slowing down or stopping the progression of the arthritis. So if you could just sort of push pause on the arthritis of your spine or arthritis of your knee, it sort of says to us, well, maybe we can think about avoiding surgery for the rest of our lives. So improved disc quality, therefore improves function. We would want to understand some more details about you, Jeff, so we can certainly go over that at the consultation. Linda from 450 says Mainz syndrome, sciatica, and joint dysfunction. So I had to look this up. Mainz is where you have thoracolumbar junction syndrome. So it is very much a joint issue. but the joint has then sent out a very mixed signal, so it's not your typical back pain. So as long as this is a disc-based pathology, or that's where we're seeing the problem lie, both in your history and in the MRI, I would say that that's very treatable. And a lot of times sciatica goes along with much of this. So for us, we do stem cells to the cervical spine, the thoracic spine, the lumbar spine. So all of this is fair game, so to speak. Sharon from 518 said, "Can bone-on-bone shoulder pain be relieved by stem cell transplants?" Yes, absolutely. We do shoulders all the time, slightly different protocol, and certainly that's why we like to explain all of this through our in-person consultation. Knees, shoulders, hips, even those who say bone on bone, something we can help. Consultation being important. We'd like to know what you've tried, done in the past. The history is pretty key for this. And from 315, very similar question, stem cell therapy for shoulders and knees. Absolutely, yes. But we do treat, I do want to say we treat one area at the time. We think dose is important. If you take a stem cell dose and give half to the shoulder and then half to the knee, neither get the full dose. So for us, we like to make sure that the knee gets fully treated. We like to make sure the shoulder gets fully treated, and really go after it one body part, one location at a time. Dave Ace from 315 says, currently have lumbar and cervical issues, thinning discs and stenosis resulting in numbness, tingling, historical sciatica. Neurologist has mentioned possible surgery, but haven't discussed what type yet. Waiting for neck MRI, have lower back images, not good. What would be surgical steps, risks? How could this alternate approach work for me? Probability of success. So not really unknowing what's showing in your spine specifically. Hard to say exactly what the surgeon would do, and not being a surgeon, don't know what the recommendations or the risks for that would be. This would certainly be a alternative for those with thinning discs, for those with stenosis. The risks and benefits with something like we do is what we describe as a ratio. So the risks involved in minimally invasive therapies like stem cells is, we run the risk of injury to nerve, artery, vein, muscle, bone, tendon, run the risk of infection. But those tend to be very, very low in what we do. We do it in the office. We have you take antibiotics beforehand. You recover from home. No general anesthesia. So the reduction of risk as much as possible. And then therefore, obviously maximizing the benefit using cells that come from your own body, utilizing a regenerative process, not using hardware. This is pretty important. And from what we've seen, and as much as we've done over the last 10 years, we're seeing 7 to 10 years of success for people with lumbar and cervical issues. And then again, all without surgery, without medication. Success does depend on a couple different factors, especially in somebody like you. So consultation would be key. Ralph from 315, spinal stenosis, had a laminectomy, been told I would live with pain for the rest of my life. I'm on several medications which help, but not completely. So I'm going to disagree. I don't think you have to live with pain for the rest of your life. I think something like this could really help solve your issue. Obviously, we'd like to meet, but we've been in that position before where people have felt very hopeless, and we've been able to deliver a majority pain relief and have it last years and years. Stenosis, post-surgery pain, very common for us. The goals for us to you, Ralph, would be to come off of the medications, and improve your activity and mobility. And I think we'd be able to help that, especially if it's simply a laminectomy. Judith from 518, is Dr. Kim proficient in knees as he is in backs? Yes. So overall, we've done probably more knees than we have spines, just because that's where we started in joints and like the knees. It's also one of the better studied parts of the body for stem cells. So I would say yes, very, very comfortable. Salim S from 514 said, I have a chronic back and leg problem. So this is one where we like to talk about the overlapping issues of back and leg pain. So sometimes back pain looks like leg pain, sometimes leg pain looks like back pain. So sometimes you might have one issue, and sometimes you might have two. For us getting through that consultation, being able to examine you and saying, oh, yes, you in fact have two problems, or yes, I think you have one overriding problem, and that would be the place to start treatment. That would be the place to start therapy. And of course, MRI is important for all this, helping us decide which is which. Um, Daniel M. from 518 said sciatica and hip pain. So sciatica is something we hear about a lot. We talk about it a lot, and these two big circles are a pretty good example. So the nerves coming out of your spine are like wires, and the wires combine to make that one big red wire. Where you pinch the wire means where you're developing sciatica. So a pinch in general just means a damaged signal, but that could be anywhere. It could be in the spine, it can be in the gluteal muscles, it could be in underneath your hamstring, et cetera, and going down to your leg. So it's most frequently, I would say, seen in the spine, especially with those with degenerative disc, arthritis. Those things tend to run together. Kim H from 518 said sciatica treatment problems. Yes, very similar again. Treatment depends on the location of where the wires pinch. So if you said the spine, we would deliver a stem cell therapy, for example, to that region of the spine, and then therefore helping that unpinch of the wire. Um, so especially if it's spine and disc, regenerative medicine, great. For example, if it is more in the muscle or like the piriformis muscle, we would do something that's called a hydrodissection or regenerative medicine in combination to hydrodissection, and we certainly have done that as well. So that's a great question from you, Kim. John K from 518 said, how to relieve my back pain so I could walk more than 100 yards. So it sounds like you might even have stenosis, John. I certainly want to examine you and get you in front of us to help make that diagnosis. For us, again, we're talking about that window of portal or of being pain-free. So once you're pain-free in that window, then you can go on to do things like develop strength. But as long as you're having pain, you're sort of blocked, really, blocked in your ability to develop strength and mobility. Dolores from 518 said back and right leg pain. So for us, the three most important things in all of getting stem cells and regenerative medicine right is these three. Number one, we've got to get the diagnosis right. Number two, we've got to process the stem cells right. So we can take it out of you, but can we refine that product to what we need? And then number three, can we place that cell right where it needs to go so that you get the maximum amount of benefit, the maximum amount of relief? The next step is diagnosis and consultation. Roberto B from 514, chronic low back pain. Same for you. Chronic, and for those with chronic low back pain, next step is making the diagnosis. When you're 20 and you're 75, those two things might be different reasons for low back pain. And so certainly we want to understand why you're having it, Roberto. Are you having degenerative disc? Are you having issues with stenosis? Or is it a more of an arthritic issue? So important to discuss. Paula from 518 said information about back bad pain. So hopefully you found this webinar helpful. More information can come from obviously an in-person consultation, but also from watching any of our prior webinars. And at the prior, and you'll see that anytime we do a webinar, the beginning is very much the same, but this is where there's huge amounts of information, and it's what other people are asking and able to sort of tease education and tease information out of myself. Robert from 716 said, just heard a stem cell option for ongoing back pain, of which my chiropractor can offer limited options since I have two complete hip replacements. So chiropractor probably did great and has probably helped you quite a bit. And those are what we call conservative therapies or what we call the non-invasive ones. But again, hip and back pain oftentimes overlap. This is certainly the non-surgical option where you're going to be able to recover from home. And for those who do have a question about chiropractic care, once the stem cell process, all three injections are done, chiropractic care can resume. Valerie from 518 said, looking to learn more on stem cell regeneration. Thank you. So hopefully what we've been able to show you that there are a lot of positives. There's many plus sides to this. It's minimally invasive. It's in office. There's no general anesthesia. The risk benefit balance is quite good. And what we're doing is cellular transplantation. We're taking cells from one area of your body and we're placing it in another to go then do activity, to go do things that parts of your body are just not good at anymore in restoring inflammation or restoring function. Nancy from 518 said, how does the stem cell procedure work and how does it help with arthritis in the back? So the basics of stem cell, and you've heard of me say it, but I'll say it once more, is that it involves direct, precise injections. We're always using your cellular materials, and typically those areas are areas of disrepair or those areas that have degenerated to help them repair the local tissue, to help that room, hole, and debris analogy help clear the debris out of that room. Georgia from 518 said, can this be used for pulmonary issues, COPD? So I will tell you that we have started treating lung issues, and in both people COPD. We have an N of two, which means just two people, a husband and wife combination. They don't like medications. There were no surgical options for them, and we've been treating them for about 10 months. The two main points on this is they feel significantly better. Their oxygen requirements have gone down. They can climb stairs much better. What we don't have is PFT data, so pulmonary function testing data to help prove one way or another. Overall, they feel better, and it was obviously something that was of value to them, and so they've continued it. And we are on a maintenance therapy, I think, of about once per month. So there you go. Donna from 518 says, what is stem cell therapy and if it could help me? So hopefully we've answered some of those questions and improved your knowledge throughout this process. Yes. Okay. So we've come to our last slide, and this is what I want to offer those who have been willing to sit and listen to me talk for all of this time. We offer now a webinar attendee discount. You just have to mention webinars when you do go to sign up for stem cells. You do have to schedule within 30 days from today, I should say. Our phone number is 518-871-9900. For those in the north, in the Quebec area, 514-697-8919. You can learn more about us from richardkimmedicine.com. You can learn and listen to more webinars from /webinars. And if you're more interested in getting that MRI first, you can hit /MRI and schedule your own. I have a webinar coming up in July. I didn't write the date here, but I will certainly update that on our webpage. So, okay, having gone through all of that, let me get out of this, and we already have 10 questions. So let me get through some of this. Let me sort of zoom out here just a little bit. Great. So Dave said a few questions. Said, I already have lumbar and cervical imaging. Can we start a discussion with those? I'm not currently having pain. Have had sciatica many times before, but numbness and tingling, mostly feet, but hands too. Image shows L5 has virtually no disc left. Is it too late for improvement? L4 is not far behind. Seems like this is a ticking time bomb. So, Dave, I will tell you that in a lot of people, they say that they've had no disc left. and this is really where I don't want to toot my own horn or pat myself on the back too hard, but this is what I'm very good at. I'm good at getting into that difficult disc and being able to put a needle right into those stubborn discs, the ones that are hard to get to, the ones that are super super thin. So I'd have to look at your MRI, but I've not had many instances where I've truly not been able to get in. So certainly at the time of your consultation, bring that MRI, and we can go over that. To your comment about being a ticking time bomb, it is to some extent, right? Like you just know that it gets worse and worse, and so going back to that analogy where I talk about sort of the room breaking down. I do the cabin in the woods analogy as well. You build a cabin in the woods, and if there's no road to make repairs to it, it's just going to get worse over time. So stem cells, platelet-rich plasma is that great answer where you can inject something. You can basically build a road to that cabin so you can start doing some repairs. So don't despair yet. Certainly, let's have a conversation and let's go over that. You asked another question. Do you perform these procedures in Skinny Atlas? Yes and no. So, of the three injections that I showed you in that timeline, numbers one and three always happen in Skinny Atlas. And then number two, you've got to come see me in Saratoga once. So, I tell people, I come see you twice, you come see me once. So, Kristen said, this is incredibly helpful and provides a lot of hope. I will be making an appointment for a consultation. Can you speak at all to insurance coverage in general terms? I know everyone's is different. And if I should plan to get pre-approval. Also, would x-rays be helpful to bring to a consult? So let's go the easier question first. X-rays, yes, if you have them, bring them along. Number two, with regards to insurance, there is not an insurance company, whether it's Medicare, Medicaid, commercial, private insurance, nobody will cover it. So it has less to do with us and has more to do with the fact that these companies are not yet covering it. So for us, we've stopped taking all insurances altogether. It isn't so much about us stopping insurances that we just can't get reimbursed for these. So there's no reason to participate. But there are some options there for payment options. We do have third-party financing, 0% interest over X number of years, et cetera, et cetera. So hopefully we can help you find some solution, and yeah, go from there. Anonymous said, I developed a cyst on my spine after a double laminectomy. Can you help me? So the question then being, is the cyst painful? So development of cyst is not that uncommon. It's something that can happen periodically, but is that your source of pain? This is something I'd probably want to see you for, see the MRI results that you've got, and then really kind of dive deeper as to um, that being the source of pain. In some instances, I will do a diagnostic injection, meaning I will inject either in the cyst or around the cyst to see if your pain gets relieved. Before I really sort of suggest, look, stem cells are the thing to do, or platelet-rich plasma is the thing to do. And I certainly wouldn't recommend that until I had that degree of confidence in the diagnosis. Will Mooney said after the 5 to 7 years of success, then what happens? Another round of shots, does the success rate diminish? Thank you, Dr. Kim. You're very welcome, Will. So great question. So having done this for 10 years, I've had people who've had to come back and do the stem cell process over again, and you continue to get the same level and degree of success and results. Even though I say 5 to 7, I have many who've gone past 7. I have a few who've had to come back before the 5 year mark. Studies are showing now that if you do the second round of stem cell, that the success rates tend to be higher. So I'll leave that with you in the sense that yeah, maybe looking at never doing an operation or a surgery for the rest of your life is possible, and I certainly am seeing it even in my own patient population. Aaron said, I am Aaron C from 561. Four back surgeries from 9905, spinal control stimulator and ischemia in 22. Would regenerative medicine cure me, or if this is something I need every few years? So, Aaron, that's the question that I think the prior person was asking. I'm going to be honest with you. I've done stem cells of the spine for over 7 years, and even in my early ones, they haven't come back yet. So when January 1st comes by of 2026, I'm going to start telling people 8 to 10 years because they just haven't come back yet. So my experience is as long as that. The 10-year mark is from what I see in the literature and in the research published. So that's sort of where I like to put the upper bounds of success. But yeah, I think it's possible that 7, 8, 9, 10 years, and even maybe even more is possible. Point being that you can repeat it again, and by repeating it again means maybe another 7 to 10 years of surgery avoidance. Kristen said, actually, I see on your site that you should not. Okay, awesome. Okay, so Will also said, based on previous questions asked, my condition seems quite minor to most others here. Is this still worth pursuing a consultation? Yeah, it will for it's a spectrum, right? So there's people who are on the milder end of things and then people who are more on the more severe things. And again, PRP is great for the mild to moderate, and maybe you won't need stem cells. So it is definitely something where I think addressing the problem early and then helping preventing it from getting worse is definitely the route to go. A lot of times in medicine, we just sort of wait till things get so bad that then we're like, okay, well, now I can't stand it anymore. Now I have to do surgery. But what if we could do something before then, right? When you first realize it's an issue and treat it then, and then maybe that will help then prevent even getting to the point of, well, I'm miserable and there's nothing left. Robert said, I've already scheduled an appointment. Can I still get the webinar discount? Yes, Robert, you can. Linda, I appreciate you and I'm looking forward to my consultation. Linda, I'm looking forward to seeing you too. Robert, is it possible to do two knees at once? One is worse than the other. So, right. So, again, splitting a dose between two of your favorite kids, not the best idea because then neither get the appropriate dose. So what I would say is it's going to be a 3 and 3 injection series. So we tend to overlap them. So it's a total of 4 visits. And so you don't have to do a total of 6 injections. So we can minimize it, we can lessen it, but we won't do them at the same time. And that's just, I think, been part of what's helped us be successful. Okay. That's the last question I've got. And I'll hang out for a minute more. Will said, thank you, Dr. Kim. This was great. You're welcome, Will. Hopefully it was helpful. Aaron said, how well does this perform? I'm on disability. Um, I'm gonna say I'm not really sure what the question there is, Aaron. I have to meet you. I have to look at your imaging. I have to examine you to give you an idea of how well I think it's going to work for you. That's really one that is very, very individualized. Rob said, any prep needed in advance? Nope. Just come as you are. I have the MRI machine. I have the staff. I have the procedure room. I've got cold bottles of water for you. No, just come as you are and start the conversation. Okay. Yeah, I think we're getting towards the end of that. Karen said, okay, one more question from Aaron. I'm on permanent disability. Would this help with the pain or potentially cure me enough to I'm gonna assume you wrote to get off of disability. I, we've seen some pretty amazing turnarounds in people. Obviously, everybody's very, very different. Hard to say without meeting you, what this can do for you. I'm gonna need to see you. I'm gonna need to see how you walk. I'm gonna need to see what your function is like to get a better sense of that. I would certainly recommend a consultation next. Rob said, "Thank you for your time." No, thank you. I appreciate it. You're welcome. You're welcome. So, Aaron, back to you. I'd probably say, yeah, a consultation is key. All right. Aaron said that's fair. Thank you. Okay. Very good, you guys. I think that's the end of the questions. Have a great rest of your Wednesday. We're maybe going to get some sun here. And otherwise, have a good rest of your week. Thanks, you guys.